In this video, we're going to cover key things that you need to know about chilblains, also known as Pernio. These are small patches of inflamed skin that can develop after exposure to air that is cold or damp but not freezing. Now, usually chilblains form on your fingers or toes, but they can develop on the legs or ears, and they're typically red or bluish, but this may not be the colour if you've got darker skin. They may also feel itchy, tender or painful. Now, in this video, we'll cover who might get chilblains, causes, symptoms, diagnosis, treatment, and finally when to see your health provider, as well as how long they last for. So who might get chilblains? Well, technically anyone can get chilblains, but females and people who've got low body weight have a higher risk of developing them. You're also more likely to get chilblains if you live in a damp or non-freezing climate, you smoke, you wear tight-fitting shoes, gloves or mittens or clothing in cold, damp weather, and even babies can get chilblains if they're not dressed in appropriate clothing, including a face covering in damp or cold weather. Now, your risk of getting chilblains or Pernio also increases if you have bone marrow disorders, a condition called lupus erythematosus, Raynauds phenomenon, or peripheral arterial disease. So what causes chilblains or Pernio? Well, chilblains form after intermittent or prolonged exposure to cold or damp air. Now, the cold air causes blood vessels near your skin surface to tighten or constrict, and this leads to decreased oxygenation and inflammation in these exposed areas. Now, the exact reason why this occurs is not fully known, but some experts believe Pernio develops because of genetics, hormonal changes, or underlying diseases, such as connective tissue disorders or diseases of the arteries. So now we've covered what causes it, what are the potential symptoms of chilblains? Well, chilblains are painful, swollen patches of skin, and although they can appear anywhere, they usually develop on your fingers or toes. They may also show up on your ears or nose, and sometimes these skin patches look shiny. You might also notice blisters, a burning sensation, itching or skin colour changes, again like I mentioned, with red or blue patches, but this will depend on your skin type. So how are chilblains diagnosed? Well, often your health provider can diagnose chilblains simply by looking at your skin. You may also have blood tests or a skin biopsy, and these tests help your provider determine if you've got a condition that increases your risk for chilblains, or if you've got another condition that mimics or looks like chilblains but actually isn't. Now, in terms of treatment, often chilblains will go away on their own, as long as you avoid the cold or damp weather conditions. However, you might need to take some medication to help soothe the pain or itching, and you can talk to your pharmacist about this. Now, some medications also lower your chances that chilblains will come back, and these include medications like nifedipine that will help dilate or widen your blood vessels, or medications that you can rub onto the skin like nitroglycerin. Now, what can you do to manage chilblain symptoms, because they can be painful? Well, when you get chilblains, you can use over-the-counter remedies to ease pain and swelling. In addition to this, I'd recommend that you first of all keep your hands and feet warm. So for example, you wear mittens or you use hand warmers, and you wear layered clothing or blankets. Wearing a hat is also important, and that's because hats cover your ears to keep your whole body warm and prevent loss of heat from unprotected areas of your body, such as your head, where actually most of the heat gets lost. You should also moisturize the affected skin area with unscented lotion, and if you're able to, you could take non-steroidal anti-inflammatory drugs or NSAIDs, so things like ibuprofen. Finally, trying soaking the affected area in warm but not hot water for short periods of time can help. Finally, how can you reduce your risk of developing them in the first place? Well, unfortunately, there's no guaranteed way to prevent chilblains, but you can help reduce your risk by avoiding cold, damp environments as much as possible, exercising regularly to improve your blood circulation, quitting smoking, as well as wearing warm clothing in layers in cold weather, especially over your hands, ears, and feet. Now, if you do smoke and you want to quit, then please check out my other video on the channel where I cover 10 useful tips to help you quit smoking. So when should you go and see your health provider about chilblains? Well, for many people, chilblains heal without treatment, but you should see your health provider right away if you've got chilblains that don't go away after 3 weeks, you've got diabetes and you develop chilblains on your feet, if you've got fever or chills, or if you've got pus coming out of the skin, because this could indicate a more serious infection. Finally, how long do they last? Well, like I mentioned before, the good news is that chilblains usually heal within 1 to 3 weeks, providing you avoid the cold or damp weather and you dress appropriately. If you're at high risk, chilblains may return every year when the weather changes. Now, your provider may prescribe treatment to prevent frequent chilblains. If you found this video helpful, please consider subscribing to the channel for weekly medical education videos. And if you want to share your own experiences to help others who might be suffering from this condition, please do so in the comments section. I'm sure this is going to help them. Thanks for watching, and until next time, bye.